My name's Charlotte, I'm 29, and I'm here to talk about my diabetes story.
I'm Helen and I'm Charlotte's nana, and I've been helping Charlotte along the road to become free of diabetes.
I knew something was wrong. I was getting more sleepier, more tired, more lethargic, really down.
Unfortunately, my daughter, Charlotte's mum, who also has muscular dystrophy, wasn't able to look after Charlotte in the manner that was needed. So I tried to step in and do whatever I could to help her. We're going to a wellbeing session at the moment for Charlotte, and I think Charlotte is benefiting from this wellbeing session more than she has from any other advice, because Charlotte is participating in it rather than just sitting and listening.
I did go to one before, but I wasn't really understanding much what they was doing. So this time I've got Nana supporting me through it. So if I don't understand something, Nana can explain to me what it means, or the ladies there can explain it.
And it's in bite-sized pieces, isn't
it?
Yeah,
it's not like all just one chop. It's all I can.
A little week by week.
Yeah, I live at a place which is called Supported Living. They sat down with me and said, right, what would you like? What would you like? Not what the other girls having. Because like 3 girls there. So I sat down with the manager and she went through what basically, and Nana was there helping me deciding what food to have. And one of the girls, after Nana left, said we're not going to do that, we're scrapping that.
There has been quite a battle with the people who are supposed to care for Charlotte, and I would say lack of care, because Charlotte's health is the most important thing.
Ever since I've had diabetes, it felt like things were crashing down. I had a lot on my shoulders. I never told anyone this, I never told Dave, to be honest. But I had a lot on my shoulders, and it felt like the whole weight was just pushing me down. Until I came the next day to Flourish, and I've had that whole weight lifted off me. I wake up every morning thinking about what we're going to do to make Flourish, and it's actually inspiring me a lot to actually wake up to something that's going to be enjoyable and not wake up thinking, oh, not another day, do you know what I mean?
Yes, because there's very little to occupy you in your supported living accommodation. The residents are left to their own devices. I can't really fault what Dave does with the people here. It's been exceptional, and it has helped tremendously, and Dave has been a support not only to Charlotte but to myself also in what I've been trying to do for Charlotte. He's been very good. He's about the only person who has been behind me.
So I've actually accomplished what I wanted to do. To lose weight and not to have that so much weight on me that would put more stress on me. So no, I feel absolutely amazing.
My name's Dave and I run Flourish. I started Flourish 7 years ago because I knew there was a need for people with autism and learning difficulties to be fitter, be healthier, and all about the food. Charlotte came to us in 2021, end of 2021, wasn't it? And that's when we got a plan together to see how best to care for you and to see how we could make your situation right, because you was just getting poorlier and poorlier. You was getting bigger and bigger,
More tired.
and more tired, more anxieties. And we sat down and we wrote a plan out of where Charlotte is now and where she would like to be. And we've really worked through them pretty well, haven't we? And you have achieved for the last 3 years, 3 or 4 years, you have achieved your goals and hit your targets every time. Hence, that's why Charlotte's 6 stone lighter and feeling a lot better about being yourself. We looked at it from every angle, really, from your training or exercise or activities that you was and weren't doing. And then we had to tailor them to Charlotte's abilities. So we did a lot of, early days, we did a lot of chair-based stuff, didn't we?
With Joe Wicks.
Joe Wicks, we did Joe Wicks workouts. And then we just advanced that to, especially with your tennis.
Oh yes.
Tennis, we did tennis on a Friday. And Charlotte has gone from really struggling to get herself down, sort of sitting down halfway through the lesson, to now tearing around the court. So we did it from lots of things. We did it from toning, we did it from cardiovascular and general fitness.
Yes.
And then on top of that, it had to be fun. So we sort of mashed all them together. So we looked at Charlotte's diet and came up with a plan of what she should be eating and what needs to cut out. And then we looked at a plan of what your activities were and see if we can increase that, which she did. And then she came to Flourish for an extra day to better your cardio, wasn't
Yeah,
it?
pretty much.
So she
Yes.
comes and does boxercise with us now on a Wednesday.
And I've got a nickname.
Little Miss Nasty, when she's training. Do you think if you did it just yourself, would you do it just yourself? What would you let down, do you think?
I think I'll let the food down.
Yes. Not saying no to
Dramatically.
food.
Yeah.
And that's been quite challenging with working in the care sector, is people who are looking out for you and looking after you not having the right knowledge about what is acceptable on a balanced meal. The thing what we do at Flourish is we discuss it with everybody
Yes.
about your condition, about Down syndrome, about how the best you can be the best person you can be, and how to get the best out of your personalities. So we really try and make that key, don't we, at Flourish? So everyone's an individual, we're person centred, and we tailor everything to the individual needs, and the outcome,
It's
I think
amazing.
it's brilliant. I think it's really, really good. So it all happens with a team effort, but
Oh,
we can't
yeah.
do it without you, you can't do it without us,
Definitely.
and it's just a big team effort that's made it happen.
Yes.
The care sector's let you down personally, but
Yeah.
that's something we've worked against,
Oh yes.
but it hasn't stopped us and it hasn't knocked us off our plan
No.
of what we've tried to achieve. So we've still soldiered ahead, haven't we, to make it all happen, really. There's some really disappointing times with some of the things you've sort of, like snakes and ladders, we've made some
Yeah.
really good gains, and then all of a sudden we're back down to start again.
Yeah.
So with extra guidance, extra lessons, so we tailored your food
Yes, we did.
to you.
Yes.
And the end result is Charlotte is no longer a diabetic.